when I'm a young parent and I'm here in the hospital, how do I deal with the fact that I'm next to a patient, also a parent?
It's often a big disaster if I have to tell young patients that they are severely ill. Mm-hmm. And often I experience that they are a bit in distress, because they not only have to deal with their own new diagnosis, but they also have to deal with how do I tell it my children.
So since let's say December 1st was our diagnosis. Your story rings a bell to me as well. So this was a Saturday where she was diagnosed with acute leukemia. And then life's changed, of course. So Saturday it was the diagnosis. We were hospitalized instantly. Monday morning we were at the fertility doctor as well to see where we could preserve some eggs as well. We chose not to do that because it was another couple of weeks we had to wait for that. So the whole, so you're pushed from white to black, if you want. So a very big jump. So in a couple of days, life changed.
And I often invite parents to bring children with them to the hospital, and so that they can see where the hospital is and where the department of treatment is, and that they see that I'm the doctor, and although I have to tell bad news, I'm not a bad person, and I try to do the best for their mother or their father, and that they can ask me questions. I often invite them to within the room and say, okay, what do you think? What's going on, and what are you worried about?
I discovered that there was nothing for children with parents with cancer, because there was a lot of information about children with cancer themselves.
Yeah, exactly.
But there was no information, nothing at all for children with parents with cancer.
Yeah, exactly.
And I thought, well, I had to do something about that. And so I started a program and make things, make movies with children. I talk with children, I talk with parents, I talk with grandparents, and well, that was 20 years ago, and then I just do it now.
Great.